everyone, and welcome back to the Diverse Thinking, Different Learning podcast. I am so glad that you are joining me here today. Also joining me is our newest Child Nexus member, Dr. Danielle Cornacchio. Dr. Cornacchio is a clinical child psychologist who specializes in evidence-based treatments for childhood anxiety, OCD, and disruptive behavior disorders. Dr. Cornacchio has particular expertise in behavioral treatment for childhood selective mutism. Please help me welcome her to the Diverse Thinking, Different Learning podcast.
Millions of kids struggle with learning, processing, and social emotional difficulties. These challenges interfere with their ability to reach their full potential. Dr. Karen Wilson is here to help. Her extensive background in pediatric neuropsychology and higher education have prepared her for this unique mission. Listen as she delivers content to inform, educate, and empower parents and educators. This will enable you to identify challenges that kids face and get them on the road to achieving their full potential. This is Diverse Thinking, Different Learning by Child Nexus.
Hi, Dr. Cornacchio. Thank you so much for being here.
Thank you for having me. I'm glad to be here.
I'm so glad you're here too. How's the new year treating you? Recording, I said you're my first recording podcast for the new year.
Yeah, it's funny you say that because it's already halfway through January, but somehow I feel like I'm still starting up. Like I haven't rebooted yet after the new year.
I know exactly how you feel. I mean, I did a solo episode last week, but you're my first interview for the new year. So right. I'm excited about hearing about all of the work that you are doing, interviewing other people about their areas of expertise and just sharing that with the community. So thank you so much for being here. I wanted to have you on the podcast because so many parents and educators do not understand selective mutism. And this is one of your areas of expertise. So here's what I'd like to do. I'd love you to start by providing a brief overview about what selective mutism is, why it's important for parents, educators, mental health professionals to understand it, and then we'll go from there. Does that sound good?
That sounds great. And I also like to talk about what selective mutism is not, because I think sometimes that gets really confusing when people don't have a ton of experience with selective mutism, including parents, including educators and providers. So I can start with what it is, and then we can go from there. So selective mutism, right now it's classified as an anxiety disorder. So that's how we conceptualize it. What it really looks like is a consistent failure to speak in certain social situations, despite clear, fine speech or comfortable speech, I should say, in comfortable settings. So typically what that looks like for a lot of kids is a difficulty speaking up in school, at the playground, in social situations, despite speaking fine and comfortably at home. So we really see this as an anxiety disorder, really closely related to something like social anxiety. That's what we see when we see selective mutism. We see kids that sometimes they look afraid, sometimes they don't. But what it really looks like is them not speaking in times where they're expected to speak. So I think I like to also say what selective mutism isn't, because I think a lot of times it gets confused with other problems, or I'll see kids who come to see me who have a diagnosis of autism spectrum disorder, for example, or people are suspecting that's what's going on. And I don't blame providers or educators for thinking that might be what's going on, because there's so many shared traits and shared observations, I think, with something like autism and selective mutism. But I always like to say selective mutism is not autism spectrum disorder. It's also not a oppositional defiant problem. Our kids are not, they would speak if they could. So it's not them willfully not speaking. It's really an inability and anxiety that's preventing them from speaking.
And I think that's such an important thing to mention because, like you said, selective mutism is often misunderstood or misdiagnosed. And sometimes parents or other well-meaning adults might see it as rudeness, as oppositional behavior, like you can speak, but you're choosing not to. And then you also mentioned that it is related to anxiety. Is it the same as or different than social anxiety? Because it seems like it has something very a specific feature that's And I'd love for you to kind of clarify that, because it's hard for parents to kind of figure out what's going on.
Yeah. I wish I could clarify it in a one sentence answer.
Right.
But it's confusing, and the jury's still out. There's a lot of research, and maybe I shouldn't say a lot, because the literature that we have on selective mutism is still pretty new. It feels pretty new. And so what the research shows is pretty mixed, whether it's a subtype of social anxiety disorder, and some people feel that it is, or is it its own kind of classification not related to social anxiety disorder? What we know is that it's, in a recent meta-analysis, 2020, it's 90% comorbid, has comorbidity with anxiety in general, and about 70%, when we look at all the studies in a meta-analysis, about 70% comorbid with social anxiety disorder. I tend to when I see kids in my clinic, I feel that I have my conceptualization is, oh wow, this kid is very socially anxious, and that's sort of what's driving the behavior. But we certainly see kids who it's really just about the speech, and they don't really have the other the other classic social anxiety. Sometimes it's hard to assess, because, and oftentimes in selective mutism, it's really sort of we see it sort of onset earlier in childhood, and it's hard because we can't ask a 3 or 4-year-old questions about what they're thinking, or are they worried about being evaluated by others. It's really just our behavioral observations. So it is can be difficult to assess more kind of classic symptoms of social anxiety disorder there. So it's not an easy answer. But I would say that what we have points us to, yes, this is very, very closely related to social anxiety disorder, if not a subtype of social anxiety disorder.
Right. And so it sounds like some of the key signs or the red flags are kids that can verbally communicate at home or in situations where they're comfortable, but then they go to school and don't speak at all, for example, or go to grandparents' house or other social gatherings and don't speak at all. Is that typically what you would see?
That's typically what we would see. And I would say it's a very heterogeneous group of kids, in that we'll see really varying presentations. So I would say the vast, vast majority, yes, are speaking comfortably to their comfort people, which is almost always parents, siblings, sometimes grandparents. And then what it looks like beyond that can be very different. So some kids don't speak at all at school. So they have their marker of, like, the second I reach the gate of school, I'm silent. And we do see a lot of kids like that who are entirely mute, if for lack of a better word, in the school setting. But we do also see kids who are selective in the school setting. So maybe they'll whisper to peers, but not be able to answer teachers' questions. Or they'll speak loud and spontaneously on the playground with their friends, but then the second they get into the group setting in the classroom, then they're shut down. So it can actually look really different, and then be even more confusing to parents and educators and other providers too.
And do we know from the literature what underlies the different presentations? Is it, fear of being evaluated, fear of being rejected? Do we understand what kind of drives the behavior?
Yeah, it's a good question. And like I said before, it's so hard to evaluate that in children and kind of understand what's going on kind of cognitively for them. And so it's an interesting question. I am not aware, and I'll do a deeper dive in the literature, of too many studies that look at the different presentations and look at them in a systematic way, kind of like a latent class analysis or something like that, where we could really understand the different presentations of selective mutism. But that's making me feel curious and wanting to kind of learn more about that, because we really don't know a ton about it. One thing, this is sort of unrelated to what we're saying right now, but one thing I didn't mention when I was saying what selective mutism is not, is related to trauma. And so often I get the question from teachers or even parents or, other people in kids' lives, like, what happened? Was there something that happened? Was there a traumatic event that made this kid stop talking? And rarely, I could count on one hand how many times I've seen that, that there's some kind of traumatic event that's triggered this. We really rarely see it. Sometimes it's something that is really benign, like they had a not so nice teacher that maybe made a comment once, and then that kind of triggered less and less speech. But in terms of a major kind of traumatic event, we really rarely see that. Sorry, that was random, but that's kind of popped in my head, and something important.
Yes. And it's really related because, when parents have kids who are not speaking in certain situations, or teachers are seeing it, they want to understand why.
Yeah.
And sometimes the question, particularly when kiddos are younger, is this autism? Is there something traumatic that happened to my child that's causing this? So I think understanding some of these, misconceptions, understanding, what selective mutism is. And again, like you were saying, what it is not is so important, because then we can move towards addressing it. And I would love for you to talk about, what does the research say? What do you do in your practice in terms of, treatment formats for this specific type of child anxiety, selective mutism in general?
Yeah, absolutely. So, like I said before, the treatment is the world of the literature on selective mutism treatment is quite new, actually. The first randomized controlled trial was done in 2013 by Lindsay Bergman, who's actually, I currently work with her at the Wavemind Clinic, and that was the first one. And so since then, there's been
That's very recent.
It feels very recent, right?
It is.
Yeah. So I think that we're still learning a lot. But what we do understand about the literature that is out there is that cognitive behavioral therapy is what is the most effective for children with selective mutism. So I like to, when I talk about cognitive behavioral therapy for kids with selective mutism, I like to talk about the behavioral kind of conceptualization of it, and this sort of, and this is how we teach parents and educators, the cycle of negative reinforcement and what happens and why, sort of like the why, like what you were saying before, why this is, how did it get to this point, right? How has this child stopped speaking to the point where they wet their pants at school, literally break their arm and can't speak up and say anything, right? Like, how has it gotten to this point, right? And so we go through this. I like to show a visual. I assume I can't share my screen, so I'll just talk through it. A visual of this conceptualization. So we think about how a child is prompted to talk or engage in conversation, maybe by an adult. Maybe a child walks in an elevator with a stranger and their parent, and a stranger says, "Oh, you're so pretty. I love your shirt. How old are you?" And the child gets overly anxious, attempts to avoid, and the adult swoops in and rescues, right? Because the adult's anxiety is kind of going up too. And you see your child not responding to an adult, that's anxiety provoking for us as parents, right? And so that parent jumps in and rescues and says, "Oh, she's just a little shy, but she's 4." And then immediately both the child's anxiety is lowered, and so is the adult's anxiety. And the child learns, "Oh, great. Mom talks for me. I'm good here. I don't need to do that." Right? It happens in school too, right? Sometimes other kids speak up for them, or the teacher they don't want to get into this uncomfortable situation or force this kid to do something they're not ready for. So they just kind of move on and say, "Oh, it's okay. She doesn't talk, but we're going to give her snack anyway. I'll walk her to the bathroom, even though she didn't tell me she has to go." And so unfortunately, over and over again throughout these kids' lives, they're learning, "Oh, I don't have to talk. I could get by here without speaking." And then it becomes this really sticky pattern of negative reinforcement. What also happens then, we use this word in treatment for selective mutism called contamination. It's such a scary word, but it refers to when people, places, or activities become sort of contaminated in a sense that child then determines that setting is a place I don't talk. And it becomes harder and harder to intervene in those settings because they have this long-standing history. I don't talk here. It's really hard to then reverse that cycle that I was just referring to. And so it works to our advantage as therapists that are brand new in these kids' lives that happen to have this set of skills. I'll touch on some of them. I know we don't have time to talk about all of the treatment skills, but I'd love to touch on some of the important ones. But we have this unique position in that we're coming into these kids' lives knowing that about all of this, and that we don't want our setting to become contaminated. So when a kid comes to see me, I'm not asking any questions whatsoever. When they come into my waiting room, when they walk back into my office, I'm not asking them any questions. I'm obviously being super positive and trying to connect with them in other ways, but not asking any questions because I don't want me or my setting to become contaminated and them to then develop a history of not speaking. So, I'll see a 9-year-old. This has happened before. I've seen a 9-year-old who's literally never spoken to any other adult in their entire life outside of their parents. And they came to see me and was talking within 2 sessions, right? 2 hours. And that's not because I'm a magician. It's not. It's because that we have these skills that work really well. And I'm not placing the expectation on this child to speak until he's really, really comfortable with me. And then we can do the work of therapy, which, we have to do that kind of initial work first in order to get to the therapy process, which I can definitely talk about too.
Right. And it seems like there's so many areas to be, where there's opportunities to intervene, but also areas where parents and educators have to understand what this is, particularly when you're talking about contamination, because I can see that if school becomes a place of contamination, then how do you treat the selective mutism when it's already been contaminated?
Yes, that is a great question. Also not one where there's an easy, simple answer, as is the case with any kind of mental health therapy. There's no simple answer. It takes a lot of work. There's a lot of layers and complexities. It requires buy-in from so many people, including educators and principals and other individuals that are working with kids at school. And sometimes there's roadblocks just as simple as like, I need to get background checked before I can go into the school and help a child. But the first step is doing the work with a therapist, right? So that when a family comes to see me for the first time, I have 2 goals in mind. One goal is to make sure that kid can become verbal with me as a therapist who knows these skills, who can then help this child then speak to other people. That's my goal. Get this kid talking to me. My other goal is get these parents skilled, teach them skills, help them learn these skills. I could touch on these skills so that they're not such a mystery, but I'll touch on some of these skills. Get these parents skilled so that they can help their child day to day. Seeing me once a week is not going to do squat unless everyone else in that child's life is kind of like trained up and learning these skills. So those are my 2 goals. And those 2 things can take a while. It can take a few weeks. It can take 2 sessions, or it can take 6 weeks or even longer sometimes.
Right. And to parents whose kids might have been struggling for months and months, 6 weeks is not a long time, right? To see that change. And it sounds like they do the work initially with you. You establish that trust, you get them communicating verbally, and then the additional work begins. And it sounds like you have to involve the parents in that work. It's not a matter of parents dropping their kids off in your office and then going for coffee and then, their work is done. It sounds like they have to be involved in the process because they have to be able to know how to respond and coach their kids and make sure they're not reinforcing some of those behaviors that you talked about initially.
That's exactly right. That is necessary. And so sometimes even if that child is talking to me, but I'm noticing that the parents are really struggling with their skills, or there's a lot of what we call enabling happening. Enabling is a term that we use to describe enabling anxious behavior, where the parents are kind of allowing their kids not to speak or allowing them to avoid certain situations. And so if a lot of that is happening, then I need to kind of shift gears and make sure that I'm focusing more on supporting the parents through those skills. But you're exactly right. Those parents really, really need those skills. And a unique part of treatment is parent coaching and being there with parents in vivo to support them. We use an adaptation of a treatment called parent-child interaction therapy, or PCIT, which is the gold standard treatment for behavioral challenges, noncompliance, oppositionality, ADHD, dysregulation in young children. And the focus there is really on parent skills and parent coaching in vivo through a bug in the ear. So they have an earpiece in, and I'm behind a one-way mirror, or if it's virtual, behind a screen. So Dr. Steve Kurtz, who's in New York, developed an adaptation of PCIT called PCIT-SM, selective mutism, to use these methods to treat kids with selective mutism. So we're pulling components. We're certainly pulling skills from that treatment program, but also pulling the method of parent coaching. So to your point, it's so important. And the most effective way to help anyone learn anything is helping them learn in the moment, right? Right there, we can catch when they're saying something to their kid and say, oh, try to say it this way. Or we can praise them, positively reinforce parents. That was a really great question that you asked her. So that's a really big part of the work that we do is coaching.
And that's really important too. I mean, we've discussed PCIT on the podcast before, but I can see how that would be beneficial in the moment for kids with selective mutism, because oftentimes, as you were saying, parents aren't aware that they're shielding their kids, right? And I think I know it's human nature to want to protect your children and to keep them safe and to reduce stress, but they need to be coached in understanding that kids need to kind of step out of their comfort zones and realize that things are going to be okay in order to overcome these challenges.
Exactly. And they might feel like they're not okay for a little while. And that's part of the learning process too. But I think that's a really important point, is that we like to validate that for parents, is that you are actually doing your best job right now as a parent in wanting your kid to be comfortable and protecting them and not wanting them to be in distress. That's our instinct as parents. And that's okay. And sometimes that's not so helpful in these specific situations. And let me help you learn how to shift that a little bit.
Right. Are there specific parent skills that you have found to be really effective in helping kids to overcome behaviors related to selective mutism?
Yes. And I want to touch on maybe the highlights. There are so many, and I can spend hours and hours sitting with parents and training them and talking through these skills. But I'll touch on some of the highlights. I think it's interesting because there's parent skills, and then there's teacher and non-comfort adult skills, right? And they're actually similar and the same. Parents are the comfort people, right? And so they need the skills to prompt their kid to do the hard things. And then educators and, teachers, other providers, people in the community need skills to communicate in a way and make kids feel comfortable. So I want to kind of maybe highlight all of them that maybe kind of like cross over there. When we're working with kids with selective mutism, we think of, I use this analogy that I referenced Dr. Steve Kurtz that he's used before, is you're in either one of two gears. You're either in the gear of this kid is not ready to talk yet, and I'm just in this mode of trying to make them feel comfortable and using just skills to make them feel comfortable and develop a relationship without putting expectation on them to speak. So that's its own set of skills that I'm going to touch on a couple of them. So when you're sitting in a room with a kid that's completely silent, how do you connect? How do you make them feel comfortable? How do you develop a relationship with someone who's not talking to you? And so toys, anything that that makes that kid feel happy and comfortable, maybe at home, right? Coloring, blocks, dolls, you name it, anything that's going to help. So we've got tons and tons of toys at our clinic that will break out depending on what a kid's interested in. So that's step one. Step two is just to neutrally describe. So inviting that child to play and then sort of describing what they're doing with the toys or what they're doing in general, right? Oh, I see you picked up the green marker. Oh, it looks like you're drawing a circle on your paper now. So just gentle descriptions of what they're doing and then praising what you notice that you like, right? I love that we're hanging out together. I know I'm a new person and I really appreciate that you're playing with me right now. So even though they haven't spoken, that's still what we call brave behavior that they're in the room with us. And so labeled praise is another skill. So behavior descriptions and labeled praise of behavior. We call it a labeled praise because instead of saying good job, we want to say great job for doing something specific, like sitting with us. Now, if the child does speak, we use another skill called a reflection. So just neutrally stating back what they said. So if they said, I'm drawing a flower, you would neutrally say back, oh, you told me you're drawing a flower. And then you can praise them for talking. Thanks for using your words with me. So descriptions, praises, and reflecting if they do speak. And we're avoiding all questions during this time. We're avoiding giving too many commands or directives for the child. That takes a lot. It's easy enough to say it, right? To just neutrally state those skills, but they're really hard in practice. And as adults, we're constantly asking questions. So it takes a lot of practice to rein that in. So those are the skills that we use, that we recommend teachers use, or people who kids are not speaking with yet, just to get kids comfortable, build a relationship. And so that's one gear. Now, if a kid is ready to talk, we're in a different gear of treatment where we can use a different set of skills to make sure that we're encouraging kids to speak and that they're answering every single time, that we're not letting any question go unanswered. And I can talk about how we do this because it can be hard sometimes. And then positively reinforcing when they do speak. So that's a different gear. And so I think I'll highlight just a couple of important skills or things to remember for people who are working with kids with selective mutism. The type of question that we ask actually really matters. So if I ask an anxious kid, what's your favorite thing to do in the summer? That's kind of a big question. It requires a lot of thought. It requires a lot and a lot of resources for that child. But if I said, do you like to swim at the beach better or the pool? That's a little bit easier to answer because the answer is actually in the question. So all they have to do is pick one. So that is called a forced choice question. And it's the gold standard type of question that we want to ask kids with selective mutism, especially at the beginning when we're still getting them comfortable with us. It's going to make it a lot easier for them to answer. What we want to avoid actually is yes/no questions because kids can nod or shake their head. And so we want to avoid that. We can always turn a yes/no question into a forced choice question, right? So if I accidentally said, did you brush your teeth? And the child's silent, I could then say, did you brush your teeth? Yes or no? Or did you brush your teeth or you didn't brush them yet? So we're always shifting the way that we ask questions to be forced choice, making it easier for them to answer. And then another really important piece of all of this is giving the child ample opportunity to answer. And this is what can be really distressing for adults, no matter if it's parents or educators or therapists. I still get uncomfortable with this, or if it's a child sitting there who's really struggling. But we do have to wait for them to answer. And our recommendation, what we tell parents, the kind of general rule is to wait 5 seconds. I'm going to give you a sense of how long 5 seconds can feel in silence. That was 5 seconds. It's a long time.
That seems like a long time. Right? I know.
And you feel it.
It does. Right.
It's a really intense feeling, and it requires a lot of distress tolerance from the kid, but also from the grown-up, because we're sitting there and waiting. But it teaches kids, we're not going to give up on you. We're not going to keep asking questions rapid fire until you answer. We're going to wait it out and let you feel this anxiety, because feeling anxious isn't dangerous. It's okay. You can feel anxious and get through this tricky situation. So now the question is, well, what happens if they don't answer in those 5 seconds?
Yes, that was my next question.
I bet.
5 seconds goes by and nothing is said.
Exactly. Yeah. So we typically try to re-ask the same questions. Maybe we rephrase it maybe 2 or 3 different times. I usually say 3 times. Repeat the question up to 3 times. So maybe you've asked a child, well, what's your favorite color? And you wait 5 seconds. Notice that's an open-ended question. So maybe that's hard for that child to answer. Maybe you notice that child's wearing a lot of purple. So is your favorite color, I noticed you're wearing a lot of purple. Is your favorite color purple or a different color? So you've rephrased the question. You're waiting, a forced choice question, exactly. And you're waiting another 5 seconds. You might say, and then you might ask one more time. So is your favorite color purple? Is it pink? Or maybe you don't know, or you don't have a favorite color, right? So you can get crafty about how you ask the question just to make that, we want these kids to be successful, right? So we're just rephrasing our questions to make them, help them be successful. And so after 3 times, that's when we move to kind of like a plan B. So in those, first of all, in those 3 tries, if a child answers at any point, that's a huge deal. That's a big success. That's one step in them kind of like reversing this negative reinforcement cycle we talked about. And so we want to call attention to that. We want to praise them. We want to say, oh, you told me it's purple. Thank you so much for answering my question. We really want to reinforce their speech. We also sometimes recommend using, I shouldn't say sometimes, we always recommend using another kind of tangible reinforcement system. So like a check chart or coins or stickers, or that's another thing we get really creative and crafty with, depending on what the kid is interested in. We always recommend schools and parents do this. And so giving them, I'm so glad you answered my question. I'm giving you a check on your chart. So you're one step closer to earning ice cream after school with mom today. So really kind of, we're positively reinforcing from all angles. What happens if they don't answer within those 3 times? But we can talk about that after if you have a question.
No, I'd love to finish that thought, because I think for parents who are saying, okay, I've done that and I've done that and that has to work.
Yeah, exactly.
And so what are the next strategies that I should try?
What's next? Yeah. And this, I keep saying this, but this warrants such a thorough, long discussion and training and all of that. So I'm just giving you kind of the highlights here. But there's a few things that you can try. I like to call it, what's my plan B, right? Okay, I'm sitting with this kid. I've tried 3 times. Now what? Now we think about, how can I take a step back and evaluate this situation and make this easier for this kid? I'm not giving up. Never, ever give up on a question that you've asked. Just make it a little bit easier for the kid to be successful. So a couple of options. So let's say this question was being asked in the classroom during morning meeting. So everyone's going around saying what their favorite color is, and this child is frozen. So one way is to try and rearrange the setting a little bit to make it easier. So maybe maybe the teacher has the luxury to be able to pull that kid aside for a few minutes and remove them from that big group and says to that kid, okay, this seems really hard right now. Let's walk over to the corner, just me and you, and try that question again. So taking a step back and practicing in a separate space. So that's one option. Return to a previous question that the child was able to answer. So maybe the question right before that was, what did you do this weekend? So if the child was able to answer that, you could say, oh, I'll ask you that question again. I forgot. Did you say that you went to the beach this weekend or somewhere else? And so if the child already answered that, they'll be more likely to answer again. And then they're kind of primed to speaking again, right? And then you can jump into that question. So you could try that. Oftentimes with teachers, how incredibly busy teachers are, they don't have this luxury to be able to stop their whole classroom and attend to this child individually. And so oftentimes we'll say to teachers, okay, file that away. Remember that you asked that question, and let that child know, this is really hard right now. I'm going to ask you again during recess or during lunch when it's a little bit quieter. Or I'm going to send you home. I want you to practice that question with mom so that tomorrow when you come in, you can try that again. So no matter what the plan B is, we're never letting that question go unanswered. Another example is like ordering ice cream, right? So this is a classic thing, or ordering your own food. Let's use the example of an ice cream shop and having parents help their child and kind of what we call scaffold it for them. So if the child is really frozen, and not able to answer, they can step outside the ice cream shop and say, okay, let's pretend I'm the person asking you. So remember, what flavor did you say you wanted, vanilla or chocolate? And just keep practicing and practicing until they're able to get closer and closer to the ice cream shop worker. Or even starting the question for them. So something like, I'll start by saying, I would like to have, and then the child answers vanilla. And then that can be the success. So those are all lots of different examples, and there's a million more I'm sure that I could go through, but those are kind of examples of some kind of like plan Bs. How do we help this kid if they're stuck?
Yes, absolutely. And it seems that, some of the key takeaways here are that one, if a parent has a child who seems to have selective mutism or has been diagnosed with selective mutism, it's important to connect with a professional like yourself who can provide parents with the support that they need to help their child. Educators also need support and guidance in terms of, supporting the child in an environment, an academic environment. And also there's a need to create a supportive and nurturing environment for these children to help them feel more safe and more comfortable with verbal communication. So there are a lot of pieces that are involved. And it's important for parents to be aware of what that is, connecting with the clinician, making sure that you as a parent have the skills, the teachers are aware of the situation, and really making sure you're clarifying any misconceptions, because it might be the teachers believe that, there's oppositional behavior because they see the child communicating with friends at recess, but in the classroom, they don't say anything. So they may not understand what selective mutism is. So there needs to be, it sounds like, a great deal of education for parents and educators and teachers. And then also the skill building for parents and educators, and then the support for the child themselves.
Absolutely. Yeah. All of the above is so important. And I think with selective mutism, there's a lot of barriers to care, for kids with selective mutism. One is that it's a pretty low prevalence, low base rate disorder. And so there's kids in parts of the country and parts of the state that don't have access to a provider who actually knows how to treat selective mutism. There's a pretty, it's getting better and better. We're doing a lot of efforts to train and do a lot of outreach. It's getting better. But there's still not a ton of providers in the community who know how to treat selective mutism. Then you have the cost barrier, right? We're at my clinic where we don't accept insurance. And so, we offer sliding scale spots, but even still that can be challenging for families. And so there's not a lot of providers in network with insurance or, low cost options to treat selective mutism. There's not a ton of specialty providers. And then I think that's one reason why it can be challenging, a big barrier to care. And for that reason, there's a lot of great efforts underway to get this information out there to families of kids with selective mutism in more of like self-help or kind of like self-guided resources that sometimes can be enough, right? For parents who just want these basic skills, or they're noticing it, want to nip it in the bud before it gets to be a bigger problem. So there's definitely some good resources out there, and people really making an effort in the community to do this that are free, that I'm happy to share in whatever format is most helpful for whoever is going to be listening to this.
Absolutely. And that's one of the reasons why I wanted to have you here, because it comes up a lot and people don't understand it, and getting the information out and just even getting started on some strategies can be so helpful. It can go a long way to getting kids on, a trajectory that leads to success or breakthrough moments. So, Dr. Cornacchio, I cannot thank you enough for being here, because I think it's a really important topic. And if listeners want to learn more about you and your work at Wave Clinic, what is the best way for them to get in to connect with you?
Yeah, absolutely. So you can visit our website that probably has the most information, and here I am searching what our URL is. It's WaveMind.
And we'll put it in the show notes. We'll definitely put the WaveMind Clinic in the show notes for sure.
WaveMindClinic.com. That's going to give lots of information about the services that we offer. So in addition to just individual outpatient therapy and kind of like parent training, teacher supports, school supports, and individual therapy, we also offer group therapy. So weekly groups, we support kids, we support teens actually who have selective mutism with a support group that we have going on right now. And then in the summer, and hopefully more frequently throughout the year, we'll start this, but for sure in the summer, we have a week-long intensive treatment program for kids with selective mutism. That is a really effective way to kind of deliver these skills, because kids can participate intensively, not take time out of school, and be around other kids who have selective mutism. And parent training is a big component of that. So there's a lot on our website anyway that goes into that. And then all of our contact information there as well. But I also want to touch on other resources. So for families, outside of just wanting to seek support in California or in LA, and certainly if that's the case, we're happy to help. But in addition to that, just kind of some of the self-help resources too. So selectivemutism.org is the Selective Mutism Association's website. There's so many efforts underway, amazing people there that are putting forth so many helpful things, like an educator's web course. There's a brochure for educators, all free, and lots of different resources there. Books that you could read to kids in the classroom. There's lots on there. And then the one other resource I will mention is if you Google Kurtz psychology, it can also give you these links too. But Steve Kurtz, who is the developer of PCIT-SM, has something called the Selective Mutism Learning University, which is a self-guided course for really geared for parents, but also any adults can participate in that. And it's also free, and it teaches parents all these skills and gives suggestions and all of that. So much more in depth of what, than what I talked about today. I just kind of scratched the surface. But those are really, really good resources. I'm trying to look and see if I have other resources I wanted to mention, but those are all my recommendations for anyone who's wanting to learn more.
Wonderful. And I will definitely put a link to the WaveMind Clinic, which is in Los Angeles, California, in the show notes, and all of those amazing resources for parents, educators, and other professionals as well. Thank you again for being here.
Thank you so much for having me. This is really fun.
Thank you so much for listening. Be sure to check out the show notes. There is contact information for Dr. Cornacchio and great resources, some of those that she discussed during this episode. I have a specific favor to ask for you. Would you mind sending this episode or just sharing my podcast with 3 of your friends or colleagues? Just 3 of them. I've been working very hard to put out valuable information to support families and the professionals who serve them. And I want to be sure these episodes get into the right hands. So if you would be so inclined, you can just click the share button, send it over to a few friends. I would be forever grateful. Thank you so much for joining me again for another episode of Diverse Thinking, Different Learning. I'll see you again next week. Bye for now.
Thanks for listening to Diverse Thinking, Different Learning by Child Nexus. For more resources, visit us online at childnexus.com.